Hello and welcome. Today we'll be exploring a complex and often challenging condition known as central nervous system vasculitis, or CNS vasculitis. This involves inflammation of the blood vessels within the brain and spinal cord, potentially leading to serious neurological complications. Join us as we delve into its causes, symptoms, diagnosis, treatment, and more. The exact cause of CNS vasculitis remains elusive in many cases. We often classify it as either primary or secondary. Primary CNS vasculitis arises without a clear underlying trigger. Secondary CNS vasculitis, on the other hand, is associated with other conditions. These can include systemic autoimmune diseases like lupus or rheumatoid arthritis, infections such as shingles or Lyme disease, certain medications, and even some cancers. Determining whether the vasculitis is primary or secondary is crucial for guiding treatment. The pathophysiology of CNS vasculitis is rooted in inflammation. When the blood vessels in the brain and spinal cord become inflamed, their walls thicken and narrow. This narrowing, called stenosis, restricts blood flow to vital areas of the central nervous system. Reduced blood flow can lead to ischemia, or lack of oxygen, causing damage to brain tissue. The inflammation can also weaken the vessel walls, predisposing them to aneurysms or even rupture, resulting in bleeding within the brain. This combination of ischemia and hemorrhage is what leads to the various neurological symptoms observed in CNS vasculitis. CNS vasculitis is a relatively rare condition. Precise epidemiological data are difficult to obtain due to diagnostic challenges. Studies suggest that primary CNS vasculitis affects only a small number of individuals per million each year. Secondary CNS vasculitis is likely more prevalent, as it occurs in conjunction with the underlying diseases that cause it. While it can occur at any age, it is more commonly diagnosed in adults, particularly those between 40 and 60 years old. The signs and symptoms of CNS vasculitis are highly variable, reflecting the diverse areas of the brain that can be affected. Common symptoms include severe headaches, often described as new or different from usual headaches. Other symptoms encompass neurological deficits such as weakness or numbness on one side of the body, seizures, cognitive impairment like confusion or memory problems, and changes in vision or speech. Systemic symptoms like fever, weight loss, and fatigue may also be present, particularly in cases of secondary vasculitis. Because the symptoms are so broad, a high degree of suspicion is needed for diagnosis. Diagnosing CNS vasculitis can be challenging, requiring a combination of clinical evaluation, imaging studies, and laboratory tests. A thorough neurological examination is essential. Brain imaging, typically MRI, is used to look for signs of inflammation, stroke, or other abnormalities. Angiography, either conventional or CT angiography, can visualize the blood vessels and identify areas of narrowing or aneurysms. However, the gold standard for diagnosis is a brain biopsy. This involves taking a small sample of brain tissue to examine under a microscope for evidence of vasculitis. Cerebrospinal fluid analysis, obtained through a lumbar puncture, is also important to rule out infections and look for signs of inflammation. While there isn't a universal accepted classification system for CNS vasculitis, it's most often divided into primary and secondary forms. Primary CNS vasculitis can be further subclassified based on vessel size involved, such as large vessel, small vessel, or medium vessel vasculitis, although this distinction is not always clear-cut. Knowing whether the vasculitis is primary or secondary guides the selection of treatment strategies. The cornerstone of treatment for CNS vasculitis is immunosuppression. High doses of corticosteroids, such as prednisone, are typically the initial treatment. These are often combined with other immunosuppressant medications, such as cyclophosphamide or methotrexate. The aim is to suppress the immune system and reduce the inflammation in the blood vessels. In secondary CNS vasculitis, treating the underlying condition is also crucial. Supportive care, including physical therapy, occupational therapy, and speech therapy, can help manage neurological deficits. Regular monitoring is essential to assess treatment response and manage potential side effects of medications. Unfortunately, there is currently no known way to definitively prevent primary CNS vasculitis, as its causes are largely unknown. For secondary CNS vasculitis, managing the underlying conditions, such as autoimmune diseases or infections, can help reduce the risk. Following recommended guidelines for vaccinations and practicing good hygiene can also help prevent infections that may trigger vasculitis in susceptible individuals. The prognosis of CNS vasculitis varies depending on the severity of the disease, the promptness of diagnosis, and the effectiveness of treatment. Early diagnosis and aggressive immunosuppressive therapy can improve outcomes. However, CNS vasculitis can be a chronic condition with potential for relapse. Recent research is focused on identifying biomarkers that can aid in diagnosis and predict treatment response. Studies are also investigating new immunosuppressive therapies and targeted biological agents that may offer more effective and less toxic treatment options. Ongoing research continues to refine our understanding and improve the management of this challenging neurological disorder. Thank you for joining us today as we explored CNS vasculitis.